My name is Luke Peterson, and today I will be talking about, in this video, the arthrokinematics of the glenohumeral joint in a closed chain movement. Okay, so I'll show you that closed chain movement right now. So a closed chain movement we're going to talk about is a patient walking in 3-point using crutches. Okay, so crutches under both arms, weight bearing the upper extremity on the handles, one leg's up in the air. Okay, going into shoulder flexion and extension through the swing through phase. Okay, and this is a closed chain movement, so that means the humerus is not producing the arthrokinematics. Okay, so there's not very much out there about the arthrokinematics of the upper extremity and weight bearing. You can find arthrokinematics in non-weight bearing. That's easier to find. So to kind of help with this, I have a picture of a hip. Okay, and it's probably backwards in this video, but in the resource list I will have this picture in there for you guys to see. So there's two ways to acquire hip extension. Okay, we have a posterior pelvic tilt, and we have the femoral on the pelvis extending too. So to show you this, we have open chain hip extension, closed chain hip extension. Okay, so that's kind of what we have going on at the glenohumeral joint. Okay, and I have a little visual for you. Okay, I have markings here. We're gonna be looking at the posterior side of the shoulder. Okay, so in an open chain movement, okay, we want these two blue lines, these two blue markers to line up. Okay, so in shoulder extension and open chain, the shoulder is going to do the humerus is going to do an anterior spin. Head of the humerus is going to do anterior spin, and that's going to acquire shoulder extension. Okay, at the glenohumeral joint. See that? Again, this is the posterior side of the shoulder. Okay, now in closed chain, this humerus is going to be fixed. Now we still want to match up A and B. Okay, we still want to get to the same, we still want those to match up. Okay, so now the scapula is going to have to do a posterior spin. See that? Posterior spin. Now this is also known, a lot of us know it as posterior rotation of the scapula. Okay, so the inferior angle is going to be going anterior, right? Again, they're going to be matching up though. These two lines want to match up. So this is a posterior spin. Okay, we're spinning. Now, if you don't have a ball, if you're sitting there and you're still struggling to figure it out, you don't have a ball in a cup. What we're going to focus on now is, again, this is the posterior side of the shoulder. We're going to focus on this middle finger and this thumb, okay? So going into open chain extension of the shoulder, anterior spin. Thumb and the middle finger match up. Okay? Anterior spin. Closed chain, okay? Middle finger, posterior spin. Posterior spin. Now A and B are matching up again. Hopefully that gives you guys a better understanding of the arthrokinematics of the glenohumeral joint in a closed chain movement. Hope that clears things up. There's not a lot of literature out there, or not a lot of resources out there that talk about upper body weight bearing arthrokinematics. There's a lot of resources out there where you can find the arthrokinematics of open chain. So hopefully that explains things a little bit better, and you understand the spinning concept.